Story 1. Some people just want you to let them go. I cared for a man with terminal cancer who broke down crying after his daughters left the room because they wanted him to keep fighting while he wanted to rest and pass peacefully. Learn when to let go. Story 2. He was one of my first patients as a nursing student. His name was Frank. He was 92. After knowing him a few days, he told me his regret was outliving everyone he loved. He and his wife had not had children. He felt he was all that was left and wanted to see his wife again. I was not sure how to respond, so I listened. It made me realize that living so long is not great if everyone you love is gone. He passed away later that week. While some of my classmates were upset, I felt relief for him because I knew he was where he wanted to be. I have had many patients since, but you tend to remember your first ones. Other than that, I agree with what others are saying, more time with family and loved ones, and I wish they had not wasted so much time on work or other things that did not matter. Story 3. He wished he had been a better father to his daughter and that they had reconnected. His dementia prevented him from remembering they had reunited years earlier and that she visited often. I wish I could have made him aware that he had fulfilled his last wish, but he died without really understanding it. Story 4. I worked in long-term care for 12 years. I remember a married couple who shared a room. She had cancer and kidney failure. One day I was helping her eat lunch while her husband sat with us. She looked near death, but her husband looked at her and then at me and said, "Have you ever seen a more beautiful woman?" I had to leave for the bathroom and cry. I cried for days whenever I thought of his words. I thought I would never know that kind of love. I had been divorced for years and could not tell the story without tearing up. I had been divorced 23 years when I met Rod. We have been together for 11 years. I know that love now. It is never too late. Story 5. I worked as an oncology nurse right out of nursing school. I was barely 21 years old. I had a patient about my age who was dying of lung cancer. A few hours before he died, I sat with him as he told me how much he wished he had had more time to fall in love, marry, and have children. He was so young. He asked me to call his parents, and he died shortly after they arrived. It was awful. His regrets were about the life not lived. Many older patients had interesting life stories and wanted to tell them before they died. Most were at peace with the lives they had lived, although many regretted working so much and not spending enough time with family. Story 6. In the emergency room, it is not something most people expect when they arrive, but when they are coherent, they often express the same regret. They wish their family were there. This has become worse recently because of COVID-19, when family members cannot be present at first. Sometimes patients call out for their significant other in panic. We tell them that their significant other is right there with them. The look of relief when they hear that gets me every time. People do not want to be alone at the end. Story 7. I am a hospice social worker, so I have the honor of listening to people's life stories, including favorite memories and regrets. Most regrets center around what people did not get to do, such as never traveling to Italy when their family was originally from Naples. Some regret not obtaining specific education, wanting to go to college but never doing it. Some regret their choice of partner, especially when alcohol or drug abuse was involved or when there was infidelity. Many express a sadness that looks a lot like regret when they are estranged from family. Some have anticipatory grief from knowing they will miss a milestone, such as the birth of a grandchild. Some regret not taking better care of their health, for example, people with chronic obstructive pulmonary disease who regret ever having a cigarette. In general, life is long and time smooths some of the rough edges, so people tend to focus on the good. Story 8. I was a new nurse working alone. We received a call for an incoming trauma. A woman in her 50s involved in a multi-car accident. We were at the ambulance bay, unsure of her condition. She arrived breathing on her own but with very labored, asymmetrical chest movement. She was bleeding profusely with multiple deep lacerations, dilated non-reactive pupils, and debris covering much of her body. Her vital signs were unstable. She was close to cardiac arrest. I stood at her head, ready to support her airway while also providing comfort and trying to calm her. She looked me directly in the eyes and, in a hoarse, labored voice said, "I was angry. I told her I was disappointed in her. She began to cry, and her vital signs plummeted. I'm sorry were the last words she spoke before her heart stopped. We performed cardiopulmonary resuscitation, intubated her, and carried out round after round of advanced cardiovascular life support, but ultimately we had to pronounce her dead. I still see her face at times, her eyes showing more emotional pain than physical. Took longer and was harder to write this than I expected." Story 9. I was a hospice nurse. One of my elderly patients had skin cancer, a large malignant melanoma on the side of his neck that was growing rapidly. He had been a farmer all his life and never married. One night we were talking and I asked if there was anything he wished he had done differently. He thought about it for a minute and said he wished he had worn a hat when he was farming. I wish he had. Story 10. I work in a hospital. When someone is at the end of life, they want to be with their loved ones. The regrets I hear are almost always related to family. People wish they had more time with those they love. Most are at peace, though, and many wish they had taken their health more seriously. Story 11. End-of-life physician here. Cardiopulmonary resuscitation. No, seriously, hear me out. Imagine using your hands to compress the sternum by about 2 inches repeatedly on your 90-year-old grandmother who weighs 90 pounds, so that you can then place her on a ventilator from which she might never be taken off alive. We ask this of everyone who comes into the hospital, but too often it is posed like, if you are drowning, do you want us to save you? When it is actually a much more invasive intervention. This is especially true for those who are unlikely to survive it in the first place and who, if they do, will be significantly worse off than before. Survival for patients with 1 to 2 significant comorbidities who experience an in-hospital cardiac arrest is less than 5% to leave the hospital alive, and 30-day survival is only a fraction of those initial survivors. I cannot count the number of times families were adamant that it be performed, only to see what it entails and then ask us not to do it again. Story 12. I trained to be a certified nursing assistant and we worked in a nursing home. I did not have deep conversations with the patients, but I can say this. If you have family in a nursing home, please visit them. It is a sad and lonely place to be. Story 13. Paramedic, but close enough. I responded to a call for a woman in her 30s with shortness of breath. She and her boyfriend had just moved into an apartment together. They were arguing over something trivial like which room to unpack first. He thought she was being dramatic. We transported her, but she did not make it. She went from awake and talking to unresponsive and asystolic, meaning no cardiac activity, in a matter of seconds. They were so caught up in a small argument that they never said goodbye or told each other they loved one another. She did not have any last words, and honestly that is even worse. Story 14. I have worked in long-term care for over a decade. I cannot speak for younger people, but most often older adults regret the things they did not do. Story 15. I remember a 40-year-old patient I had who was dying from breast cancer that had spread throughout her body. She had been diagnosed with breast cancer 10 years earlier and had a mastectomy. The doctor recommended a bilateral mastectomy with reconstruction because of a high risk of recurrence. She said she wanted to keep a natural breast rather than an implant in case she remarried and wanted to feel whole. Later, she regretted not having the bilateral mastectomy. She believed that if she had, cancer would not have developed in her remaining breast and she would not have been dying at such a young age. The patient never ended up marrying. A week later, I was diagnosed with breast cancer. I immediately told the doctor I wanted a bilateral mastectomy with reconstruction. I had an aggressive form of cancer. My doctor kept pushing a lumpectomy, which I probably would have chosen before I heard how much she regretted her decision. I feel that by sharing her regret, she saved my life. Thank you all. I thought this would just get buried. I pray that those facing breast cancer will recover. You are not alone. I was 48 years old at the time of my diagnosis and have been cancer-free for 10 years now. I think of that woman often. She was a mother of 5 and a true blessing. She was my last patient on my final shift before I got my results and started chemotherapy. If it had not been for her, I know I would not be here. I had grade 3 human epidermal growth factor receptor 2 positive breast cancer. Story 16. Advanced emergency medical technician here. Most patients I see in my ambulance are too sick to talk. One sticks with me. A man in his mid-40s called us for chest pain. We put a 12-lead electrocardiogram on him, and he was having a massive heart attack. For those who know the term, he was showing tombstones on the electrocardiogram. The sad part was he had medical training, so he knew it was not good. We were radioing the hospital. He looked me straight in the eye and said, "I should have eaten that cake." When I asked what he meant, he told me, "Forget what others think. If it makes you happy, do it. Eat the cake, pet a squirrel, take a nap. Forget anyone else, it does not matter." He had a cardiac arrest shortly after we arrived at the emergency room and did not recover. Now, if I want to do something just for fun and my wife asks why, all I have to say is, "I want to pet the squirrel." Please do not actually pet wild squirrels. They are wild animals and can bite. Tombstones on an electrocardiogram indicate massive damage to the heart muscle due to a blockage. The electrical pattern can look like tombstones. These events are sometimes called widowmaker heart attacks because of the high fatality rate. I could not tell him what his electrocardiogram said because of my level of training. As an advanced emergency medical technician, I can obtain and transmit electrocardiograms but not interpret them. He asked to see it and knew what he was looking at. Story 17. I had taken care of many patients with coronavirus disease 2019 and had seen many die. I once cared for a woman who lived in an adult family home. She was fully cognitively intact. Her adult family home had a coronavirus outbreak and she contracted the virus. She spent weeks in the hospital and was eventually placed on end-of-life care as she declined. She was kept heavily sedated on a patient-controlled analgesia pump to ease her transition. One night, I heard her intravenous line beeping with the line-occluded alarm. When you work with the dying population on these pumps, you learn the occlusion alarm often sounds when a patient dies because there is no blood flow. I stood outside her door listening to the alarm. I sighed and told the nearest certified nursing assistant to wait by so I could announce a time of death. I donned my personal protective equipment and went in, and she was still alive. I restarted her pump and stood there for a minute, listening to the hum of the high-efficiency particulate air filter. I realized that throughout her entire stay at the hospital she had not been allowed a single visitor and had gone through the whole experience alone. I grabbed a warm washcloth and wiped around her eyes. The moment the warm cloth touched her skin, she whimpered, leaned into me, and sighed deeply. She opened one eye and, in a very quiet, slurred voice, said, "Thank you. I should have spent more time with you." I left the room and cried for the first time since the pandemic began. She died a few days later. Story 18. This is a difficult question to answer. I am an intensive care unit nurse and have been present for many people's end of life. The reason it is so difficult is surprisingly simple. People come into the intensive care unit, they are put on a ventilator, which involves a tube in the trachea through the vocal cords, and then they cannot speak. Depending on the medications they require, they are often not conscious either. So communication usually happens before the ventilator is placed, and either A, they did not have time to express ideas about regrets because of the urgency, or B, they did not think it was time to express those ideas. They thought there would be more life, more opportunities. The problem is they often did not tell family members or loved ones their wishes before coming in. I come on to a shift several days later and I do not actually know this person. I have not heard their voice or their ideas. What I have heard about my patient is from their visitors, their loved ones and family. My job is to remind those people that under the tubing, behind the equipment and the drugs, under the blanket and on the bed, is their loved one. The person is the point. We also care for the machines. Machines for breathing, machines to keep the heart pacing, devices that help a tired heart pump, machines to do the work of failing kidneys, and machines that try to compensate for diseased lungs. We use medications that assist the machines and support the body to do what it currently cannot. The patient moves from day to night and back again, and families often ask us to try one more thing, then another because they want their person back. Sometimes we can give more time together. Sometimes we cannot. If you have ever wondered about the regrets of dying patients, these are common ones they often cannot express. Common regrets include not having told loved ones they did not want every possible intervention, only some for a time, not being able to tell family no when they could not speak, and living with conditions worse than death, which becomes their current reality. The point is this: do not wait until you are there. Have a conversation with your significant others about what you want to happen if the worst occurs. Do not put it off because you think it will bring bad luck or because it feels unpleasant. Discuss organ donation as if you really had the chance to decide. Let your loved ones know what you think, and save your actual end-of-life regrets for things like not going to Disneyland or spending too much time commuting. Thank you for reading. Story 19. My mother worked in home health and hospice. My stepfather was very abusive, and my mother would take me to work with her to try to protect me. She did not want to leave him because of her religious beliefs. There was an elderly man I would play cards with. We would talk about working on the farm we had. He was a kind man who realized I was being physically abused. His health declined and he could no longer play cards or get out of bed. The last time I saw him, he apologized that he was not younger and said he could not help me. It was almost 25 years ago, and I still remember him. Story 20. A 27-year-old man who had tried to end his life died from his injuries. I remember his story clearly. He told me his entire life story, and I did not sleep for several days after hearing it. He was bullied from middle school through the end of high school. He had mild Asperger's syndrome and was intelligent, but because of his appearance and mannerisms he was singled out. It got worse over time. Girls made him drink from the toilet. Boys put him in chokeholds until he passed out, tied him up in the gym and left him to wake alone after school, and stole his clothes and threw them in a dumpster so he had to crawl into it to retrieve them. At home, his parents beat him for being late. Girls made false accusations that led to his suspension, after which his parents beat him again. Girls replaced his lunch with rotten food or feces and boys pelted him with rocks. It was unbelievable. He finished high school barely, dropped out of college, and left home to work in the service industry, where he struggled with stress. He also said he considered himself an involuntary celibate and that his only reason for living was to be a target so others could feel better. He told me he had tried to end his life because he was tired of it all and was also financially broken by then. This was around 2008. He said he wished he had stood up for himself from the start, thinking things might have been different. He died a few days later while I was off shift. We all knew he was unlikely to survive given his injuries, but I still remember his story. I hope he is at peace now. Story 21, a little different, but I worked in a gastrointestinal lab and we had a much older man, probably in his late 70s or 80s, come in for gastrointestinal issues. During the procedure, we found cancer and it was a death sentence. He had likely refused a colonoscopy until that point. The doctor said it was horrific. We could not get past the cancer because it was so advanced. He estimated a few months. After we finished, I was at the bedside with the patient when the doctor came in to talk. The family and the patient would not accept the diagnosis. The doctor backed down and did not tell them how bad it actually was. I was upset because the doctor effectively lied to the family and gave them false hope. I still wonder what happened to him. Whether he spent his last days fighting and wearing himself out or whether he allowed himself to enjoy his last months. Colon cancer is horrific. It looks like the word cancer, alien and disgusting. Please get your colonoscopy when you are told. You are not just saving yourself. You are protecting your children, who will be screened earlier if something is found in you. If you do not get screened, they may never know they are at risk. Edit. I have seen some questions, so here are some recommendations. They changed the recommended screening age from 50 to 40 a few years ago. That does not mean insurance will cover it at that earlier age, but advocate for coverage. If they find precancerous polyps, follow-up is typically 1 to 3 years depending on number and severity. If they find small polyps, follow-up is 5 years, and if there are no polyps, 10 years. If they find many polyps or precancerous lesions, your children, brothers, sisters, and other close relatives should get their colonoscopy as soon as possible regardless of age. I had a mother who had a colonoscopy for symptoms at about age 40 and was found to have colon cancer. Her 20-year-old daughter had a colonoscopy a week or so later and also had colon cancer. Both survived because it was caught early. Lastly, the bowel preparation is unpleasant, but no one is looking at your anus during the procedure. The doctor may perform a digital rectal exam, but most of the time it is not necessary. You will be heavily sedated. The colonoscopy itself is quick for most people, often about 10 minutes. Legally, we have to observe patients for at least 6 minutes. So go forth and get it done. Story 22. Not yet. I can't die yet. I still have so much growing to do. I want to see my children and grandchildren grow up. I am a physician trainee who has done a decent amount of palliative care. I have been privileged to hear many stories and to be part of many deaths, but I still cannot explain why certain lines remain with me and hit me so much harder. The gentleman who told me the line above was in his late 60s to early 70s. It made me reflect on how I view patients in this age group, yes, much older than myself, but still with growing and living to do. I also think of a woman in her 50s I met early in my training. She and her female partner had never married, partly because of the laws at the time and partly because it had never seemed important. When she was diagnosed with metastatic pancreatic cancer, they regretted never making that step. I attended their small wedding in the hospital. She died a few days later. Story 23. I have been a nurse for 14 years. One thing that still haunts me is a 14-year-old boy with cancer. He had a transplant but died from the side effects. I cared for him for almost a year, and we grew very close. The day he returned to his home country in the United States, I told him I was his big mama and that when he returned we would make many plans. His dream was to be a doctor, so I told him I would quit my job and be his nurse the moment he became a doctor. The night before he and his family left, my husband, a chef, cooked his favorite foods for the family and all the nurses. My husband taught him how to cook the recipes. He also loved to cook. We had dinner together and I cried afterward. He was like a second son to me. His last words to me were that he would make sure to meet me again. The day his mother told me he had passed away, I was devastated. Story 24. I will never forget the time working as an emergency medical technician in the emergency room when I helped a woman get on a commode. I told her I would give her some privacy, and she grabbed my hand and murmured, "Please stay." I asked her what was wrong and if she was okay. While she was sobbing, she managed to say, "I am so scared. They just told me I am dying and I do not have a chance anymore." It broke my heart. I stayed, talked with her for a little while, and comforted her as best I could. Another time, a regular patient with multiple cancer complications was on his last legs. We knew each other by our first names. At the night huddle, we learned he was finally going to be placed on hospice, and he bought pizzas for the entire department. I went into his room and tried very hard not to cry and to thank him. I am glad I left the hospital and returned to being a first responder. It was too depressing. Story 25. Being alone can be especially difficult. While people with family face different problems, those who have no one often have the hardest time. Story 26. I used to be a nursing student. I decided to drop out in my second year because it was not where my heart was. During my placement at the city hospital, I talked to an older man. He must have been about 88 then, in 2010. He told me I looked exotic and often complimented my long hair. I was never threatened or put off by it. One day he told me I looked like the woman he wished he had never let go. He said he was completely happy with how his life turned out, that he loved his family and his late wife, but he always thought about the woman he should not have let go by. Years later, I met a man at work who ended up moving across the country for a job. I remembered that old man and followed my heart. I never let my love get away. I married him this summer. You should always at least try. Even if it does not work out, go for it and find out so you never wonder. Thank you for all the responses and the award. I was not expecting people to react to a cheesy experience like mine. 3 people direct messaged me to ask for more about my story with the old man. John David. Here it goes. John David described this woman and his relationship with her as the perfect little blip in his life. She was a petite Indian woman. I am a petite Pakistani woman, with long black hair and the most amazing smile. They met when he was 18 and she was 16. He was a jock at college and realized that her brother was taking the same classes as him. He befriended the dorky Indian guy to get to his sister, who worked at the grocery store in town. It worked. They dated for 6 months before she randomly broke it off. It turned out she was uncertain about where their relationship would go and about being in an interfaith and interracial relationship. John David wished he had fought harder, because her brother married a Chinese woman, and if it had not been for his jockey, dumb attitude, he would have gotten over her decision to end things and fought harder for her to understand it would be all right. Decades later, this petite, long-haired girl with an amazing smile came back into his life, and he was flooded with memories of the love of his life. He said the 6 months they were together were the most deep, loving, and peaceful months of his life. She was the one who got away. He said back then you would fall in love in weeks and you loved hard, and that was the love of his life. To the people contemplating asking out their crush, do it. To the women waiting on a man to make a move, do something about it. To the person unhappy with their career choice, I changed my mind twice. If you put your head down and try, you will always find some solace in that. Story 27. I was in the room with a patient when her doctor told her she had only a few weeks to live. I knew her well and had spent quite a bit of time talking with her before the news. In the days that followed, she seemed to accept that she was dying. She had lived a beautiful, independent life, maybe not wealthy, but genuinely happy. On the 10th day after receiving the news, while I was helping her into the tub, she suddenly broke down and could not stop crying. She cried about how much she wished she had not put her dog down because they could have died together. Turned out her dog was also dying. She had put him down a few days before going into the hospital because she felt her own life was ending. She hated herself for it and for missing the opportunity to spend their last moments together. It was heartbreaking to watch and hear. She passed away early in the morning 2 days later. I took a couple of mental health days after she died and spent some time looking for dogs to adopt and jobs to apply for. Story 28. I do not know if this will be seen. This blew up and I will probably delete it in the morning. I worked security in a hospital. In the emergency room, we had to sit with any patient placed on a 5,150 mental health hold so they would not leave. In California, a 5150 mental health hold means the person is considered a danger to others, a danger to themselves, or gravely disabled. It is a legal hold. I had, I think, a 17-year-old girl who came in after a Tylenol overdose. I normally do not listen or get invested with patients because it is usually the same faces on a loop, but she kept trying to strike up a conversation. Eventually I relented and she told me how stupid she felt, that it was over a boy, where she was going to college, what she wanted to do, and basically her life story. I left for a break. She was stable in the emergency room. The next day I came in and asked whether she had gone home or been admitted to an inpatient unit. They told me she died a few hours after my shift. It has been about 5 years. When I think about it, I break down and cry. I do not cry often. The last time I cried before this was when my grandpa died. But I can talk about that now without crying. Her death is the only thing that completely breaks me down. Story 29. There are 3 main themes I have heard over many years of working in palliative care. 1. Regret about missing future family events such as graduations, grandchildren growing up, weddings, and other similar occasions. 2. Regret about staying around harmful or toxic people, including bad jobs or abusive or uncaring family members. 3. Regret about not taking better care of their own health. My main takeaway is, if you smoke or drink excessively, stop. Figure out what in you makes you believe it is okay to be treated poorly, and change that. Tell everyone you care about that you love them as often as you can. Story 30. I used to work on the respiratory ward of a hospital almost a decade ago. I was young and occasionally took a puff from my friends when we were out drinking, only a few times to be honest. One day a patient held my hand. She was dying and short of breath. I tried to be there to calm and reassure her. She told me to never, ever smoke. She regretted smoking when she was young because she was now dying from it. She hated smoking because of all the damage. She described it as drowning. She said the sensation of being choked and losing your breath was absolutely terrifying. Her words stuck with me. During her final days, we kept her as comfortable as possible as she struggled to breathe with medication and supportive care. She passed shortly afterward, but I was not working that day. I never forgot her advice and never took another puff. Story 31. This was a strange case for me and is actually relevant to my current life. It happened 6 or 7 years ago, and I still think about her. She was an older woman in her 70s with a history of breast cancer. She was in the intensive care unit for sepsis, I believe. I talked with her, and she mentioned she was widowed. I offered my condolences and said, "That must be hard. I am sorry for your loss. I imagine you miss him." To my surprise, she replied, "No, actually, I do not. I was relieved when he died. I was never happy with him. I did not leave him because that is not what we did back in the day. So I wasted many years with a man who did not treat me well, and now I have cancer." That was a powerful life lesson. Story 32. People often regret not taking chances, such as visiting England, and not spending enough time with the people they love most. Remember to do what you love and do not do anything during the day that you will regret at night. Story 33. I was diagnosed with T-cell lymphoma on my birthday in 2016. I was told if my chemotherapy did not work, I had weeks to live in 2017. Up until that point, I thought I would beat it, even though by then I had gone through more than 14 rounds of different types of brutal chemotherapy. It seems stupid now, but until the doctor uttered those words, I had not even made my will. None of us were expecting it. I was in shock. I was 34 or 35. This was not how my story was meant to end. Why me? The doctor promised he would help as much as he could to transition me to palliative care and get the process started. One moment I was preparing for another routine doctor meeting where they would say we had run some tests and explain what we were going to do. The next I was silent. Anger was my first stage. I was bitter and angry for a short time, but after looking at everyone's faces, that feeling passed. I watched everyone deal with the news around me. In the room were my favorite nurse, my mom, my wife, and the doctor. I had never seen my mom look so helpless. I could almost see the hope drain from her as she leaned against the wall for support. She was just told her child was going to die, and this time she could not fix it. The nurse who had been administering my chemotherapy and who I had seen almost every day was deeply affected. I was later told she broke down and had to leave work early. My wife, who I had put through so much, was clearly trying to hold it together. She was in the anger and bargaining stage. She would not accept the diagnosis. She looked for second opinions, researched other hospitals, called and emailed them, and scanned reports and test results. She refused to accept it and kept working. I sat there with what felt like countless thoughts, watching it all go on around me. When you are told you are going to die, eventually you reach acceptance. Once I accepted that there was nothing more to be done, all the little things in life that annoy, stress, or anger you faded. Everything became beautiful. My perspective completely changed. My time was running out and I just wanted to be surrounded by love. My only regrets were about time. I did not do enough with it. I did not get to see my beautiful baby niece grow up. I wondered if she would take after her mother, my lovely sister, who never got to enjoy her pregnancy because her brother was diagnosed with cancer months before she was due to give birth. I regretted wasting time being angry with my father. We wasted time ignoring each other over petty family issues. I regretted not traveling more. I regretted not taking more photos of myself with my wife and my family enjoying holidays instead of just pictures of museums, buildings, and food. Now I am on strong medications, scrambling my brain for memories of my wife's face when she saw our view from our hotel in Croatia. When you are dying, you can look up art and architecture online, but the real value is the pictures of you with the people you love. Cancer stole our joy, and I just wanted to see the twinkle of happiness in the eyes of my loved ones. Love and time, that is all that matters. Summary: I was diagnosed with stage 4 angioimmunoblastic T-cell lymphoma on my birthday. My regrets were time wasted on petty things and not doing more with it, not forgiving people over petty issues, not taking more family photos, and not traveling more and creating more memories. Story 34. I work in a hospital delivering trays to patients. I have had multiple patients who have requested a final meal, only to be gone by the time I get it to them. I have not heard their last words, but I think seeing what their last meal would have been says a lot on its own. Edited. Thank you for the award. I have no idea what it means, but it made my day. Story 35. My grandmother was a nurse. She would say that she had seen many people in their final days and heard many regrets, but she never heard anyone nearing the end of life say they wished they had spent more time working. Story 36. As a medical student at Stanford, I got to see some very important people. One in particular was a middle-aged, high-ranking executive at an iconic company. This person was terminally ill, and I was tasked with the initial interview. During my history-taking, they spoke about the ride up the corporate ladder. It all seemed worthwhile at the time, chasing wealth and prestige. In the end, however, their regret was walking away from opportunities to build a family and invest in meaningful relationships. They poured their heart into the company, and yet no one could spare the time to visit them in the hospital. I still remember them in the hospital bed, staring out the window with a blank expression. It haunted me for a while but helped me change my focus, especially in a field full of high achievers. Story 37. They do not take their sick leave or paid time off, work themselves to exhaustion throughout their lives, and are not present for their loved ones. Story 38. I do not know what to make of this. I worked in patient transportation for about 4 years, so I encountered a lot of people. The most common thing I heard was "do not get old." Felt like I would hear it at least a few times a week, if not more often. I will not say much more, but hearing that from dozens of people from diverse backgrounds who all ended up in the same situation makes you think. Story 39. The one I remember most is a sweet elderly lady whom I had been caring for. She had been through a lot in her life and had spent much of it worrying about everything. The night before she passed, we sat and talked for a while about everything. I asked her if, given the chance to do it all again, she would do anything different. Right away, she told me she wished she had laughed more. Such simple words, but they had a big impact on my life. Story 40. A man told me that he had worked his whole life and that this was all he had, as he pointed at items on his dresser. His children were not even there. He died later that day. Story 41. Trigger warning. Self-harm and suicide. I had a teenage girl in my psychiatric ward because she had tried to kill herself by overdosing on pills. It was touch and go, but she was revived and admitted. When her parents could come in and see her once she was awake, she was crying uncontrollably, apologizing and saying she did not want to die. Her parents sobbed and told her it was okay and that they loved her. They later went home, and we did not see them again. That is the way I need to tell that story to prevent myself from breaking down and being unable to work there. A few years later, I read the coroner's report into her death. A subsequent suicide attempt was successful. The report concluded that no combination of interventions or specialists could have prevented this death. It felt like a physical punch when I read that. It still hurts. Story 42. A little off topic. I am a doctor who has been caring for patients with coronavirus disease 2019 for the last few months. Dying patients have been unable to have anyone by their side through most of the pandemic. We started doing video calls so family members could see the patient one last time. The other option, allowed recently, was to attend their loved one in person, then quarantine for 14 days and accept that they had been exposed. We had a patient a few weeks ago who was up and down for several days, and finally I saw he was headed downhill fast. I called his wife and asked if she could join a video call to see and speak to him one more time. She was in her 70s and did not have a smartphone. No one was home, and she was hesitant to come to the hospital because her son was undergoing chemotherapy. My voice trembled as I asked her if she wanted me to say anything to him. She told me to tell him she loved him and that he was her best friend. These have been the best 52 years of her life. She said she would see him soon. She started sobbing and hung up. I went over to the patient, who was barely conscious, and relayed the message with my voice cracking. He died not 10 minutes later. I sat in the office sobbing for a long time afterward. He was one of my favorite patients because we were birthday buddies and had some nice conversations when he was lucid. When he was delirious, he would tell me thanks, but I am married every time I went near him. Story 43. I am a former intensive care unit nurse. I cared for a patient in his 40s who died from complications related to acquired immunodeficiency syndrome. At the end, he developed an acute respiratory infection, and my colleagues and I cared for him while he was acutely decompensating. We had to intubate him, but he quickly became comatose and died within a couple of days despite all treatment. He came from a religious family but was estranged because of his homosexuality. He found religion again when he realized he was dying. It breaks my heart that he had convinced himself God was punishing him for being gay. My colleagues and I tried our best, but his belief and his regret were lifelong, and our time with him was so short. I will never forget being at his bedside. He was gasping for air and, between breaths, telling me desperately that this was his punishment from God and that he deserved it. He died before we had a chance to help him. Story 44. I did a 1-month elective in palliative care as a student. I enjoyed it and did my best to make people as comfortable as possible during a difficult time. Felt very rewarding. I met many people near the end of life, and conversations about biggest regrets or best memories came up often. The top 3 I heard most often were: 1. I should not have spent so much energy on negative emotions or hatred. The things that made me angry now seem trivial, and I wish I had spent my time being happier and more positive. 2. I should have worked less, worried less, and spent more time doing things I enjoy with people I love. 3. Not having children. Many people who did not have children said their biggest regret was not giving it a chance, never finding the right partner, or realizing it was too late. Not meeting their grandchildren or not being there to see their grandchildren grow up also came up often. I heard many other stories specific to individuals, but those 3 were by far the most common. A few people said they had liked someone when they were young and wished they had been brave enough to ask them out. Life could have been very different, and they would never know unless they had tried. One side note: I saw many different ways people coped with death. Some were very brave and stoic, some were anxious and scared, and some were full of anger because they felt cheated. In the end, they all died, and I felt sad for those who spent their last days in anxiety or anger. It is not a pleasant way to go. I always told myself that, no matter how or when I die, I will try to face it with courage and remain cheerful until the end. Story 45. I work in long-term care. The majority are male. Many of the men regret their marriages. One patient had a psychotic breakdown in his 50s. He is in his mid-70s and in hospice now, and he says his entire family has not talked to him since. All he knows is that words were said and he burned all his bridges. Happy things happen too. Story 46. I've been in medicine for 13 years. I was working in a progressive care unit, caring for a young man of about 22, the same age I was then. He reminded me of one of my buddies from back home. He was jaundiced and liver failure from alcoholism and was being taken downstairs for a computed tomography scan. He needed total care. He was my age and dying from alcoholism. He looked me dead in the eyes and said, "I'm fucking tired of this." There was an exhausted sincerity in his voice. I think I just nodded and said, "I know, man." He coded and died on the computed tomography scanner when he went down. I'll never forget the look in his eyes and the sound of his voice when he said he was tired of it all. It sounded like he had given up, a resignation to his life, with all the regret of drinking and destroying himself packed into that brief statement. Those few words said a lot. I've been around a lot of death. I'm a paramedic working full-time in a busy emergency room for the last few years. I've worked in oncology, a level 1 trauma intensive care unit, and a burn unit, but I still remember that young man and his last words. I never had an issue with drinking. Story 47. The case that affected me most was a new mother with postnatal depression. She attempted to kill herself by cutting in the bathtub and was found by her husband. She was in the intensive care unit for a while, had lucid moments, and would try to pull out her intravenous line, so she was restrained. When I went to take her blood, she stared at me the entire time. I gave her an awkward smile and she said, "I wish I had not fucked it up the first time. Will you please tell the nurse to fucking kill me already?" I left immediately. Story 48. People regret what they did not do more than what they did. The regret I see most is letting go of those they care about. Losing someone, missing someone they used to be very close to, and ending up with no one is the worst. Story 49. She said that her son would not put her out of her misery. She only said it once, but I hope I will have the opportunity to be a euthanasia nurse one of these days. The way we are forced to drag out death for people who are of sound mind and in unbearable pain is cruel. Story 50. Nearly all the patients I have cared for in the intensive care unit did not have the ability to speak by the time they were dying. I did have one woman who was dying relatively slowly, and I remember her saying she regretted how boring her life had been and how she had wasted it by doing nothing but being a housewife. She said this in front of her adult children, who sat there embarrassed. Another story that stuck with me was my preceptor when I first became a nurse, who told me she was going to travel the world as soon as she retired. She was about 4 years away. She had spent her whole life devoted to being the nice church lady and nurse after her husband died in his 20s. And she never put herself first. In my second year of nursing, she passed out in the parking lot on her way into work and was soon diagnosed with stage 4 cancer. She later passed away and never had the strength to travel. I remember telling my introverted self that I did not want to just work, die, and end up with regrets. I should live my life to the fullest. Now I am working as a travel nurse in Curacao, living a life I never dreamed possible. Story 51. The saddest experience I had working in a hospital was a 90-year-old man with advanced cancer who had no relatives. He was a full code patient and wanted everything done to extend his life. He was terrified of dying and never ready to accept it. He lived about a month before he died. What bothered me most was that people that old and sick are often ready to stop fighting, or at least have come to terms with death. This man, however, remained afraid until the end. I could not imagine what his last month was like, knowing he was dying and feeling terror the whole time. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.